Joining us now, U.S. Surgeon General Dr. Vivek Murthy. He is also the co-chair of President Biden's COVID Advisory Board. Thank you for being here this morning. Help us understand this. If there is enough vaccines to make it eligible to all adults by April 19th, fantastic news. When can we expect more restrictions to be rolled back?
Well, Steph, it's good to be with you today. And there is good news out here. We have growing supply a vaccine. We have over 108 million people who have received at least one shot. And by April 19th, as you heard the president say, we expect that the vaccine will be available to all adults of all ages. But the real critical question here is, are we seeing cases come down? And unfortunately, we haven't seen that quite yet. In fact, over the last 2 weeks, we've seen an uptick in cases. And the concern is if this continues, then we may be into a fourth wave. But that really depends on what we do in two ways. One, how quickly we vaccinate people. And second, it depends on whether we can hold on and continue to take some of those precautions that we know work to slow the spread, like wearing a mask, avoiding indoor gatherings, and washing your hands.
Andy Slavitt said last night that half the U.S. population will have at least one dose of the vaccine by this weekend. For all of those people, many are frustrated. They're saying they did everything that was asked of them. Why should vaccinated people be subjected to all of these restrictions?
Well, Steph, I think what we're seeing more and more is as we learn more about the virus and how vaccinated people actually are protected, we're seeing the CDC issue more and more guidelines that open up the kind of activities that people with vaccines can do. So, for example, the CDC has now said that people who are vaccinated can actually gather with others who are vaccinated without a mask, that they can, when they travel, that they don't have to be tested beforehand or quarantine afterward. And I think as we learn more about the experience of vaccinated individuals, the science will guide us to open up and release more and more of those restrictions. So that will absolutely come. But what we have to recognize right now is that because vaccines aren't 100% perfect in terms of their efficacy, because they're not 100% perfect in preventing asymptomatic infections as well, we still have to be cautious, because all of us have to recognize that we may be able to spread that virus at a much lower rate, certainly if we are vaccinated, but we've got to be cautious. But make no mistake, the vaccines work, they're safe. You should get them as soon as they're available to you. And the quicker all of us get vaccinated, the more easily and the faster we're going to be able to get back to our way of life.
The White House is ruling out any involvement in vaccine passports. What does that mean and why?
So what the White House has said and the administration has emphasized is that the government will not be requiring or issuing vaccine credentials. And that's important to know. Now, the private sector has certainly launched a number of initiatives to try to develop some sort of credential system whereby people can attest to and confirm that they were vaccinated. And what the government and the administration really believes is that if the private sector is going to do that, that there need to be strict standards to ensure that people are protected, that their privacy is protected, and also to ensure that these are accessible to everyone and not only available to those who have economic needs.
You had said that these vaccines work. That's a big positive. But how do they work against these new variants? There's this new one in California, the double mutant variant. How much protection do the current vaccines give us against these new variants popping up?
Well, Steph, it's an important question, because one of the reasons that we believe that we are seeing an uptick in cases is because of variants, and in particular because of the B.1.1.7 variant, which was originally detected in the UK and which is now spreading rapidly here in the United States. But the good news is that the vaccines that we have available here, the Moderna, Pfizer, and Johnson & Johnson vaccines, seem to be effective against the variants that are circulating here in the US. But here's what we can guarantee. We can't guarantee that will always be the case, that new variants may not develop and may be resistant to the vaccine. That's why it's so important that we get vaccinated quickly and get cases down, because the more burden of infection we have in the community, the greater the chances that new, more dangerous variants will emerge.
Speaking of Moderna and Pfizer, my own kitchen table has a recurring question. If these vaccines are effective for at least 6 months, does that mean that 6 months from now, all Americans are going to need a new round of vaccinations?
Also, well, there are good questions coming up at your kitchen table for sure. And this is a question that others have had as well. The data that came out from Pfizer saying that their vaccine appears to still have efficacy at 6 months, that was more of a floor, not a ceiling. And we anticipate, in fact, that the efficacy of these vaccines lasts actually well beyond 6 months. So while we don't anticipate that people will need to get revaccinated at 6 months, what we don't know yet, and what's yet to be determined, is will we require an annual vaccine like the flu vaccine, or will we be able to go longer? Time will tell. But I think you can feel good based on the data we have now that the vaccines afford strong, robust protection. I anticipate that will last well beyond 6 months. And so the goal is really just to get that vaccine to as many people as quickly as possible.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.